Hello everyone, Erin Zenwar here. So, tests take time, treatment is quicker. There is a TV show called House or Dr. House or something like that. And it's a fabulous show with Hugh Laurie in it. And he plays this incredible genius that diagnostic who diagnoses critical condition patients coming in with horrendous diseases, or not so critical, who then become critical usually. And the whole show is about him coming up with, for those of you who haven't seen it, go watch, very entertaining, is about him not knowing what is wrong and him going, well, we don't know what is wrong. We need something before this person dies. We are better off treating them, not having tested them, than testing them and having them die while we're waiting for the results. That's kind of the underpinning thing that constantly happens. And so often they sit in a room and they diagnose based on symptoms, and then they try and work out what the cause probably is, and then they treat for that. It's a super clever show, and I have absolutely watched the whole series because it's definitely in the realm of something that Erin loves to watch. The thing that grabs me about this line and what you're watching here is actually this is very common in the Western medical profession. And the area that is the most common, can anyone guess? Oh, yes. Oh, don't forget to like, subscribe, follow, comment, all that sort of stuff while I'm in the middle of it. Now, what was I saying? Can anyone guess where they most likely are guessing at what your problem is and they throw something at it? The biggest guesses in the world are GPs. And if you ask a GP, of which I have treated many GPs, if that's true, they will tell you even they Google shit. So they tell us not to Google, but they Google, which is always interesting. Anyway, second, antibiotics has been probably the biggest area. And I would also say antidepressants have been the biggest area of guessing. People are like, really? Is that true? Well, one of the reasons we have antibiotic resistant realities going on and people who no longer respond to antibiotics, and we had to stop doing what we were doing, is two reasons. One, hypochondriac type people coming in with every little disease, it was easier to give them something than nothing, so they would just give them antibiotics. And then two, people coming in presenting with cystitis or some kind of infection, they would ballpark what was the most likely cause of that infection. So it's a reasonable guess, right? Most likely the bacteria that causes this is going to be this. And they would send you away with that antibiotic. Now, back in my day when I was very young and I was at university, I had interstitial cystitis. They would assume that I had a UTI and they would give me the E. coli killer antibiotic for that. And what happened to me was I proceeded to get worse and worse. And every time I went back and I would say, well, I have a UTI, they wouldn't run the tests for kidney problem. And they would continue to give me that which killed off the bacteria related to the E. coli caused UTI infection. And so what would happen is invariably it would get better while I was taking the antibiotics, and then it would get way worse after. Why? One, because we hadn't corrected the imbalance. And two, because the antibiotic did me some favors, but it didn't really do, like while I was taking it, but it didn't really do me any favors in the long term because it wasn't targeting the right thing. Much later on in life, after going through holistic practitioners, I started to realize I was getting interstitial cystitis. Initially, it was kidney problem. And then I started to realize that the cystitis that I was getting was connected to the kidney adrenal fatigue, which is connected also to how my system works. So I would say that what I was getting was a tripwire that was telling me I was living incorrectly, but no one had actually diagnosed that side of things. Not even the holistic practitioners had gone, oh, you actually need to work less, you need to do this, you need to be more careful with these foods. I got prescribed foods to eat that were really helpful, but I didn't get prescribed what not to eat so much. And I certainly didn't get prescribed how to live differently. That's a whole different realm of holistic work. And not everybody teaches it. But my point is, I was given an antibiotic without them testing my kidneys, without them waiting for the test to come back on the urine to see whether it was E. coli caused. And that was never corrected. And it was never E. coli caused. Fast forward many years later, I have taken penicillin because of a tooth problem. And I checked with the dentist. Are you sure I need the penicillin? Yes, 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 take it. I said, I know it's a sledgehammer. Are you sure? Yes, take it. So I took the penicillin, and after taking the penicillin, within 20 minutes, I would notice cystitis would start occurring in my system. I stopped taking the penicillin eventually because the cystitis would keep coming up, and people kept telling me that can't happen. And I'm like, I'm telling you it's happening. I'm telling you I take that tablet and within 20 minutes, I'm getting symptoms. And guess what? It's consistent. So I'm telling you the penicillin is doing it. Nobody believed me. But what was happening was I was having to filter the penicillin through my kidneys, and that was significantly helpful tax on my body. And it was starting to create an imbalance in my kidneys that resulted in an infection in my kidneys. I then went to the doctor to get something else to help with the kidney infection in case it got really bad, because you should be careful with your kidneys. If they give up, you can end up with sepsis, right? I've eaten something that's irritating the back of my throat, so excuse me. So, water. So, they test me. I spend 15 minutes telling a nurse about my history with interstitial cystitis. Things have moved along somewhat. She tests my urine and does the testing on site and goes, oh, there's no E. coli. I'm like, wouldn't there be E. coli if I had a UTI? Well, yes. Didn't I just tell you it's not a UTI? And she was surprised. She was surprised after everything I told her. It's my kidneys, it's my kidneys, it's my kidneys. Now, the next step is super crucial. They go, oh, well, then it's a kidney infection. I was like, yes, I've just spent 15 minutes telling you it's a kidney problem. So also it makes sense given the penicillin, the way my kidneys were. It just made sense. It was a kidney infection. So then what they do is they prescribe antibiotics. I asked the question, how do you know it's these antibiotics? Well, it's most likely that the kidney infection you have is more often than not caused by this particular bacteria. And as a result, we will give you this antibiotic. Meanwhile, we will send your sample away to be tested. And if we have the wrong antibiotic, we will change for the new antibiotic. So you want to put antibiotics into a system that's just reacted to penicillin. And I can tell you I react to every antibiotic as well, as does my mother. And my dad was allergic to penicillin. And I'm like, so you want to put antibiotics into a system that didn't like the penicillin in the first place, and then you don't even know if they're the right ones. Great. So I took the prescription and I filled the prescription and I sat on it until I had to take them. When I took that prescription, it absolutely made me better in a short space of time, which meant I didn't have to go to the hospital. And I was quite fucked by this point. Had I waited, maybe I would have burnt through it. But I decided I didn't want to take the risk because I didn't want to be in hospital rigged up to shit. I wasn't going to do that. I was going to have to just resurrect my system afterwards. After taking that antibiotic, yes, it helped me, but I then got a full body rash. And even while I was taking the antibiotics, I said to my boyfriend at the time, I feel like I'm on fire. And he said, I was just like, I feel super hot. And he's like, oh, they made you better within an hour, blah, 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 blah. And he was very gaslighty about it. And to be honest, I will not date someone who speaks to me like that ever again, ever. It will be an instant end to relationship. But then I ended up with a full body rash and I was off work for another week and a half because my whole left foot blew out. I had a rash all up and down my back. Like, it was horrendous. The rash actually started across. I thought I had fucking mono for a second. It was wild. And it was the right antibiotic, but it still caused a massive reaction. And so here's the other thing. Not only did they not run the test before prescribing an antibiotic, which is still a thing that they do today, they go on the most likely cause, but they never gave me a list of side effects. When I looked for side effects on the box that was not listed, I had to go online to do that, which I thought was a legal requirement, but apparently it's not. Whenever they prescribe something to you that they don't actually know you need, you are going to be hit with some side effects. I was hit with a side effect. It kept me off work for another 2 weeks, but at least I stayed out of hospital, and that's the way you can look at this. If it had been the wrong antibiotic, I would have had to take another one, which means not only would I have had a full body rash, but I then would have had to deal with the side effects of a new antibiotic. And I'm grateful that it was over within 3 weeks, right? And that was from taking penicillin from the dentist for me, right? After he pulled a tooth, and he actually pulled one of the wrong ones out as well. One was a wisdom tooth, and he took a molar he shouldn't have taken, according to my actual dentist. Emergency dentistry. So even the dentist reality is an interesting one, where he was like, oh, must have been hurting for a while. And I'm like, no, it wasn't. And there's a reason it wasn't. It's because I cycled golden seal. So it was naturally killing off a whole lot of bacteria in my mouth as I was cycling golden seal. And as a result of that, the crack in my wisdom tooth actually hadn't shown up, even though it had been there for ages, in any painful way, until I overly pushed my system adrenally by being awake for like 24 hours. So take it from me. When you go to the doctor, ask them, why are you giving me this? Oh, because it's for this. Cool. Have we tested me? Have we actually tested me for this? Oh, we will run the test, but it's most likely what the cause of your symptoms are. That's the bit you want to hear. Okay, if I wait for the results of the test, is that going to be a problem for me before I start taking this? See what they say. And don't just listen to what they say. Listen to what their body says. Have a good look at them. Did they tell you the truth, or did they tell you the party political broadcast? Because with drugs and drug companies that are educating the doctors on how to use these drugs, there is a party political broadcast when it comes to, which basically means there's a line that you toe, right? Yeah, exactly. So when it comes to asking good questions, watch the person. This is what projectors do. We watch you. And when someone goes to say yes to me, but there's a hesitation, I'm like, yeah, nah. Like I was saying yesterday, when someone wants to get well, you ask them, do you want to get well? And you see them sort of pull back. You're like, oh, I just hit you with something that you don't have an initial yes response to. So there's something in you that means no. When you see a doctor pull back, when you ask them a question, there is resistance there. The question is resistance to what? And that is for you to feel out or work out with your own intuition. But ask more questions. Make sure that if you're taking a medication, it's absolutely necessary that you take it, be it we don't have time to fuck around and this most likely is going to help you, because there are side effects to every drug. If you've got time to wait for your test to come back. Yeah. If you don't have time to wait, it's up to you what you feel to do. And I would say, if you're going to get a second opinion, don't just get a doctor's second opinion, which I think is worthwhile because all doctors are working differently now. It's a really different time in the world. But the other side of it is get a holistic opinion. I have an excellent acupuncturist. When I want a second opinion on what I think, I refer to him. I see what he says. And usually he confirms what I think. And sometimes we find that that's not in any of the medical data. We go through bloods, we go through screenings, and it goes, yeah, this is fine, that is fine. And I go, what did you find? And he said, oh, this. And I'm like, yeah, I found the same thing, but it's not in the blood work. The blood work says that's totally fine. He's like, no, it's definitely off. Now, if you understand how acupuncturists work, they look in your tongue, they look up and down, and they test your blood, they test your pulse. And they're very, very refined response system to understanding what pulse flow means with regards to how your organs are working. They are for optimization. I am for optimization. Doctors are for keeping you from dead. It's a different purpose. They're for keeping you in the workforce as a good slave. So have a great day. Don't forget to comment, like, subscribe, whoever is watching in the background. I don't know who it is, but have a great day. And I will see you again soon. Bye.